Hello, my name is Dr. Shahada Balanain and I'm the correspondent for MedEdge NEA at the first annual meeting for the Emirates Clinical Chemistry Society and the Digital Health and Laboratory Medicine Forum in the beautiful city of Dubai. I'm very honored to be joined by the conference co-chair and a global leader in laboratory medicine, Professor Damien Gruson. Welcome, Professor, and thank you for being here.
Thanks a lot, Shad. So my name is Damien Gruson. I am the head of the Department of Clinical Biochemistry in Clinique Universitaire Saint-Luc, an academic hospital in Brussels. I am also fortunate to be the chair of the IFCC division on emerging technology and super pleased to be the co-chair of this wonderful conference of the Emirates Clinical Chemistry Society.
It's an honor to have you. How are you finding the conference so far?
So far, so good. Very well organized. I think we have a top scientific program, great speakers, so the audience will enjoy.
That's great. I hope it's a fruitful day. So, Doctor, let's talk about something that's transforming the diagnostic laboratories worldwide, which is mass spectrometry. To start off, for our audience who are not familiar with this technology, can you please explain what is mass spectrometry and how it's reshaping the modern diagnostic services?
Yeah, clearly, and to make it simple, with mass spec and like an ion torrent, we are splitting the molecules based on the ratio of mass and charge to have a specific signature of molecules, complex or not. The advantage of mass spec is we are gaining in specificity. We are discriminating more in comparison to some other methods like immunoassays. And with the progress of the technology, we are having now very nice sensitivity, so we can detect low concentration.
Okay. So mass spectrometry is considered a specialized technology. How is it feasibly applied or used in hospitals, not just in reference laboratories, for example?
Yeah, I think it's a reference method, and it was considered to be practiced in reference lab.
Yes.
But now the pricing of the technology has reduced, making it more accessible. There is also automation coming, so I think that there is a new wave of mass spec, more automated, more accessible, but we have also in parallel the development of new high resolution mass spec system that can make the academic world or the reference lab exploring new frontiers in the measurement.
That's good to hear. I think the main challenge would have been feasibility, but since that is already addressed or tackled, I think it can be implemented more smoothly in many hospitals and laboratories.
Yeah, and important to mention that we need to have multidisciplinary team, as there is some specific expertise to mass spec, so to have the trained technologists, scientific supervisor, so we need these human competencies to make this technology really efficient.
From your experience and point of view, what do you think are other challenges that are being faced when it comes to implementing mass spectrometry, other than the costs and feasibility?
Yeah, so the investment, having the expert team leading the mass spec, getting this capacity also to get research with the new instrument, the new generation, high resolution. So keep the pace between research, and then when you have a new pattern of molecule, how you can transfer this to routine.
Right. Thank you very much for highlighting those challenges. I'm sure that it's being tackled and worked on extensively. From now a practical point of view, how is mass spectrometry used in clinical settings and influencing decision making? For example, in fields like endocrinology or toxicology.
Yeah, we have multiple applications of mass spec. We can measure panel of tests like immunosuppressant, not only a single molecule but different class of treatments. We can use it also in therapeutic drug monitoring and in endocrinology. Very helpful to discriminate, differentiate the different compounds that could be chemically close, and we are benefiting of the specificity of mass spec. The example of today was measuring steroids in the case of adrenal disease and having the panel of androgens, panel of adrenal hormone measure specifically with mass spec.
That's very fascinating. Now, since this conference is also about digital health, do you see artificial intelligence being implemented in mass spectrometry?
Yeah, clearly upfront, where we have to deal with metabolomics, new high volume of data coming from the mass spec, interpreting the results, finding new molecular signature for the disease. That's the first part. Second part, at the era of system biology, combining omics, liquid biopsy results, mass spec results, and make them digest via AI to have some scoring or responses more understandable by the clinical teams, for example.
So it basically simplifies the data.
Yeah, indeed.
Now, looking at the future and also to give a message for the future generation of laboratory professionals and young professionals who are also passionate about laboratory medicine, what advice would you give them to help them tackle mass spectrometry and also implement it in their career?
So for the young, I will say you are doing a wonderful job as specialists in laboratory medicine. You have a super panel of new fascinating emerging technology, including mass spec. So be trained, learn, discover, and it's really important to get this mass spec and new gen mass spec coming to the routine for the patient, for the physician. So you are bringing your knowledge with the technology in the service of the patient and physician, which is super cool.
Thank you very much for your empowering message. It's very motivational. I'm sure your talk is going to be of benefit to many, many professionals. Thank you very much, Professor, for being here with us and for sharing your great insights into the innovation of laboratory medicine.
Thanks a lot, Chad, for the interview and the invitation.
Okay.